The answer from Dr. Price is that this bill gives new flexibility to states. It gives new flexibility to governors. It also obviously could have a big impact on people with pre-existing conditions in that states will be able to obtain waivers and then insurance companies will be able to charge people with pre-existing conditions higher premiums.
Just tell you.
Yeah.
This business of these low-risk pools, they're not funded.
$8 billion they're adding is not enough, you're saying?
$8 billion is not enough to fund the higher. It's ridiculous. And the fact is, states are not going to opt for that. See, I think the fundamental issue here are the resources. I don't want to give you exactly the numbers, but it's about half the resources in this bill that were in Obamacare. Now, I can tell you that we can do with less resources, but you can't do it overnight, and you cannot give people a $3,000 or $4,000 health insurance policy. You know where they're going to be? They're going to be living in the emergency rooms again. So they were just trying to fulfill a campaign promise, and I still say they should have worked with the Democrats. Now, if the Democrats didn't want to work with them, because some of them did not, then they should have called them out. But you tell me what happens to people. Think about our listeners. What can you buy for $3,000 or $4,000 a year? Not much. And if you have to consistently visit the doctor, how are you going to pay for that? The deductibles will be so high. And again, in Medicaid, you're going to knock all these people off after 2020, which is just a few years away. These people who now are getting covered across the country.
So let me just be clear here. You are not going to seek any waivers for the state of Ohio when it comes to the requirements for insurance companies with people with pre-existing conditions, when it comes to essential health benefits. You're fine with the rules as they are.
I would say that I'd like some flexibility. I know there's a push to try to have some kind of a work requirement for able-bodied Medicaid recipients, and I'll work with my legislature to respect the kind of things that they want. But there would be no reason to move to a high-risk pool, because a high-risk pool is not funded. So I would just stay in the traditional program on the exchange. The problem, look, this is all going to be changed, Jake. You can't do it this way. You can't starve these programs, and that's what's happening.